Well, years ago, physicians were able to spend time with each patient and develop a strong relationship. I had always envisioned practicing medicine this way, with care being patient-driven and physician-driven. I knew the more familiar I am with a patient, the better my care will be. Well, during my 15 years in a traditional practice, I realized how insurance companies were increasingly dictating the type of care that I provided. This made it very difficult to focus on each patient. When I changed a few years ago to the concierge model with a limited number of patients, I instantly witnessed more satisfied patients. As a nice side effect, I noticed my ability to focus on each person increased. And it became extremely rewarding for me too. I felt like I really am able to practice medicine the way it should be. And studies show that when a patient is open and forthcoming with a doctor, with a high level of trust between the two of us, they get more focused and complete care. It's not just that my patients have more time with me, but I have more time to now take a deep breath, relax, look them in the eye, and discuss any topic that they wish. To have my patients be healthier, I found that by taking the time to fully explore their overall health status, I may then develop a strategy to help them improve their situation. Whether I am working up some symptoms or more commonly performing a complete physical and wellness exam, the more fully I know my patient, then the better suited I am to provide their care. The next step is for me to engage my patient into some beneficial action, whether this involves exercise, nutritional changes, quitting smoking, losing weight, or emotional improvement. I must know my patient well enough to really motivate him or her. It's not enough to simply write a prescription or make a list of suggestions for them. I must tailor my recommendations to the individual patient. In fact, the increased access to me via my personal cell phone number or through the ease of making an office visit, my patients have the comfort to discuss anything with me. Quite often, someone sees me for an acute injury or an acute illness, and through our relaxed discussion, we may transition to more important health matters. Some examples would be a family issue or work stress, depression, you name it, but something underlying. By then addressing these deeper issues, I'm able to help my patients become or stay healthier. I agree that our healthcare system is troubled. It's growing more complicated and less personal. I know many fine physicians who have retired early or changed specialties altogether due in part to the constraints of the system, and also their growing frustration with healthcare. Fortunately, there has been a growth in recent years of truly personal practices and concierge-style medical offices. It's encouraging to see more patients choose a practice with greater access to their doctor. This issue of access to doctors is also evident with specialist care. I help ease my patient's mind by referring to specialists whom I trust. In fact, our staff is able to facilitate specialist appointments. Plus, I have the time to communicate with the physician to either help explain the specialist's findings or their plan, or work together with the specialist to really form a team.